Let us continue our discussion for your fundamentals of nursing. So we have here your unit 5, which talk about the health and illness. Okay, so health and illness is a fundamental concept in nursing practice. As nurses, our goal is not to treat diseases but also to promote health, prevent illness, and help patients achieve optimal wellness. Understanding the concepts of health and illness helps nurses assess patients holistically, meaning we look at the patient not only physically but emotionally, socially, and spirituality. So now, let us first define the terms. We have here health, wellness, illness, and disease. So let us first understand what are the difference between these terminologies. First, health and illness are individualized perceptions, meaning descriptions of health and illness may vary among people in relation to geography or culture or depending on their beliefs and experiences. However, we have here the general meaning of health, which means health is a considered or health is a standard or fundamental right of every human being. It is a state of integration of the body and mind. Or in other words, a person is healthy when the body and mind function together in harmony. Okay, so that is your health. Now, your wellness refers or it is a condition in which all parts and subparts of an individual are in harmony with the whole system. That is a definition based by Betty Newman. Positive health symbolizes wellness. It is value term defined by the culture or individual based by Rogers. So again, wellness is a state or in simpler terms, wellness refers to a balanced state where all aspects of person's life are functioning harmoniously. While illness, on the other hand, is a personal state in which the person feels unhealthy. It is a state in which a person's physical, emotional, intellectual, social, developmental, or spiritual functioning is diminished or impaired compared with previous experience. Or illness is the personal feeling of being unwell. A person may feel sick even if medical tests do not show a disease. Okay? So again, it is more on personal state. So if the patient feels unhealthy, if the patient feels sick, then it is an illness for her. Okay? So while disease, it is an actual alteration in the body function resulting in reduction of capacities or a shortening of normal lifespan. Again, or it can be a actual alteration in the body or a body structure or function that results in a decreased ability or shortened lifespan. So ang difference between the two, illness is a personal state. Okay? It is more on a subjective state of the patient of he or she is in pain or he or she feels sick. While if there is an evidence or alteration, an actual alteration of the patient's feeling, okay, of illness, then that's the time that the patient has a disease. So example, the patient tells you, I don't feel good today. I feel like I'm sick. Now, you check the vital signs. Okay, by checking the vital signs, you see that the patient has high fever or high temperature. Or he or she has a increased blood pressure. Now, you will now interpret those data. You will report it and then the doctor will now have to understand why is it that the patient has a high temperature and a high blood pressure. So, that is the actual alteration. Now, by identifying the actual alteration, you will know what is the disease. So, a patient may feel extremely tired and weak, believing that something is wrong with their body, and this is illness. However, if the laboratory tests confirm anemia or infection, this is now considered disease because there is an identifiable physiological problem. So, yan yung, that's for the differences. So, another definitions of health may include health is a state of complete physical, mental, social, and social well-being, and not merely the absence of disease. Because when we talk about health, okay, mom, when we ask our patients, what are your perception about your health status? I'm okay, I'm good, I think I'm healthy enough. Okay, so when you check, okay, physically, she's okay. However, mentally, she's stressed. She deals with different losses. Socially, she's not good because she's introvert. So the total well-being of the patient is not on the healthy side. But the patient feels healthy, however, she's not, based on the evidences. Okay, health. Another definition. Health is the ability to maintain the internal milieu, and illness is the result of failure to maintain the internal environment. That is based by Claude Bernard, which means the person as can be considered healthy even if they have medical condition, as long as they can function well and maintain balance in life. So example, a person has hypertension, but she can do activities of daily living, and her hypertension is well managed. So that means the patient is in good health pa rin. Okay? So another health is the ability to maintain homeostasis or dynamic equilibrium. And homeostasis is regulated by the negative feedback mechanism. That is based by Walter Cannon. Another definition, which comes from Florence Nightingale, health is being well and using one's power to the fullest extent. Health is maintained through prevention of diseases via environmental health factors. So, Florence Nightingale emphasized that health can be maintained by preventing diseases through environmental factors such as a clean water, proper sanitation, and good ventilation. So, example, in hospitals, diba? We maintain a clean environment, proper waste disposal, and good ventilation because this helps the patient prevent infections. Okay? So, other may include, we have another definitions. Health is viewed in terms of the individual's ability to perform 14 components of nursing care unaided. This is based by Henderson. So, based on her theory, 14 components of health. If you are capable of doing that 14 components or activities, then you are healthy. Another, by Callista Roy, health is a state of process of being or becoming an integrated and a whole as a person. Another, by Dorothea Orem, health is a state that characterized by soundness or wholeness of developed human structure of bodily and mental function. For Imogen King, health is a dynamic state in the life cycle, and illness is an interference in the life cycle. Based on Dorothea Johnson, health is an elusive, dynamic state influenced by biologic, psychologic, and social factors, and health is reflected by the organization, interaction, and interdependence and integration of the subsystems of the behavioral system. So that is the different definitions of health. Based on or additionally, if you have other theories known, and you can also use that one as a definition, because we have different theories in the nursing practice that they define health different based on their models or based on their theories. Now, let's talk about the dimensions of health. Health is multidimensional, meaning it includes several aspects of person's life, which has first physical dimension. This includes the genetic inheritance, age, developmental level, race, and gender. So this refers to the body's physical conditions, okay? But when we talk about physical dimension, it talks about physical condition. Example, a person who exercises regularly, eats a balanced diet, sleeps well, is maintaining a good physical health. Next dimension of health is emotional dimension. This refers to how mind affects body function and responds to body conditions. Or this refers to how a person manages feelings and responds to stress. Example, a patient who practices relaxation techniques to manage anxiety is maintaining good emotional health. Next, we have here intellectual dimension. This involves cognitive abilities, educational background, and past experience, or it may include learning and decision-making skills. So example, a diabetic patient who learns about diet management and medication demonstrates intellectual involvement in maintaining health. Next, we have here environmental dimension. This includes housing, sanitation, pollution of air, food and water, or also climate. So example, communities with clean water supply and proper waste management tend to have a lower rates of infectious diseases. Another dimension of health is your socio-cultural dimension. This includes economic level, lifestyle, family, and culture. So, example, family support can greatly influence a patient's recovery from illness. And last is your spiritual dimension. This includes spiritual beliefs and values or sense of meaning in life. So example, many patients rely on prayer or spiritual counseling to cope with illness, and you have to respect that. So this dimension of health should be respected because race by race, culture by culture, tradition by tradition, we have different applications. We have different principles in becoming physically fit, physically healthy, emotionally healthy, intellectually healthy, environmentally healthy, socio-cultural healthy, and spiritually healthy. Okay. Now, let's talk about the different models of health and illness. Okay, so there are different models of health and illness that we used in order to understand how health and illness occur. One example is your health illness continuum, which describes that health as a dynamic process that changes over time. A person may move from optimal wellness to illness and back again depending on lifestyle, environment, and healthcare. So it was theory by Dunn, which describes the interaction of the environment with well-being and illness. So another is your health belief model, which describes a person's belief and behavior. So, our health changes depending on what we believe and what we behave and how we behave. Okay? Another is by Level and Clark's agent host environment model, or what we call the ecologic model. This describes the three interactive factors that affect health and illness. Another model is by Pender, which is health promotion model. It describes the multi-dimensional nature of persons as they interact within the environmental to pursue health. And we have also Smith's model of health. Smith proposed that the multiple views of health are organized into four distinct models, namely clinical, we have role performance, adaptive, and eudaimonistic. Okay. So, out of these models of health and illness, we have also common cause. We also believe in different common causes of diseases. So, why does illness or disease happens? First, diseases can occur due to different factors such as biologic agent. So this includes microorganisms such as bacteria, viruses, and fungi or parasites. Another, it may be caused by inherited genetic defects. So some are inherited from their parents. So, example, cleft palate or cleft lip. These are inherited defects from the parents. Another, it may be caused by developmental defects such as imperforated anus. So when we talk about developmental defects, this happened during the development of the infant or fetus in the mother's womb. So maybe the patient has poor prenatal checkups, or the mother took any medications that could cause to that kind of defects. Another, it may be caused by physical agents such as radiation, extreme heat, or cold. So if you're exposed to that, then definitely you may have or you may develop diseases. Another, chemical agents. Okay, exposure to toxic substances can cause diseases. Example, your lead, asbestos, or carbon monoxide. Another is tissue response to irritations or injury or due to stress. Tissue responses to irritations or injuries. So if you have experienced motor vehicular accidents, or head injury, spinal injury, no? So such as inflammation or fever. Another is faulty chemical or metabolic process. Example, inadequate insulin, or in diabetes, or we have inadequate thyroid hormones and goiter, such as that. Okay? Another is emotional or physical reaction to stress. So, emotional or physical stress can also affect health. So, example lang natin, if we have fear or anxiety, or any person under constant stress may develop hypertension or anxiety disorders. So now let's talk about the stages of illness. How does a person experience illness? Okay, so it has different stages. Namely, it has stages. First, the symptoms experience. The person begins to notice symptoms and feels something is wrong. So at this moment, or at this stage, the person believes something is wrong in three aspects: their physical, cognitive, and emotional. After they feel that, okay, there's something wrong with me, the next step or the next stage will be assumption of sick role. The person accepts that he or she is sick and may seek medical advice from family. May seek advice first from family or friends. Okay. So, they will ask, Mom, I feel sick. What do you think is the treat for like this, like that? Okay. So, they will now lie in bed, and then they will rest because they feel that they are really sick. Now, after assumption of sick role, they will contact their medical care provider. They seek advice to professionals for validation of real illness, explanation of symptoms, and reassurance or predict outcome. Okay? After contacting their medical care contacts, okay, they will have a dependent patient role. The person becomes a client dependent on the health professional for help. They either accepts or rejects health professional suggestions and becomes more passive and accepting. So this happens when the patient will confine themselves in the hospital, and then they will either follow the treatment regimen or either refuse. Okay, and then after the dependent patient role, after implementing nursing interventions that improve the well-being of the patient, and then you will let the patient achieve independence, then they will go to the last stage of illness, which is recovery and rehabilitation. The patient gradually returns to their normal activities. The person becomes a client dependent. The person gives up the sick role and returns to former roles and functions. Okay. So that are the stages of illness. Again, first, symptoms experience, and then after, assumption of the sick role. Then after assumptions of the sick role, they will contact their medical care. After contacting their medical care, they will now perform dependent patient role, and lastly, for recovery and rehabilitation. So now let's talk about the different risk factors that may cause a disease. So when we talk about risk factors, these are the factors that increases the likelihood of developing a disease. So example, we have genetic and physiological factors. So, for example, a person with a family history of diabetes mellitus is at risk of developing the disease in a later life. Okay. Next, we have age. Age increases and decreases susceptibility. or risk of heart diseases increases with age for both sexes. So example, the more we age, the more their body is vulnerable to different diseases. Okay, nagde-decline. There's a decline in the physical or our systemic functions. Okay? Next, environment. The physical environment in which a person works or lives can increase the likelihood that certain illness will occur. So our living conditions can also affect our health. Next, the lifestyle. Lifestyle choices significantly affect health. Lifestyle practices or behaviors can also have either a positive or negative effects on health. If you do good lifestyle such as good nutrition, or eating well balanced diet, okay? If you do exercise at least 30 minutes to 1 hour every day or every other day, okay? So you have a good lifestyle. Now, if you don't have a good lifestyle such as sedentary lifestyle, then definitely it will have a negative effect on your health. So, now let's talk about the classifications of diseases. How can we classify diseases? So we can classify diseases according to etiologic factors or according to the cause, according to duration or onset, or according to, or maybe described differently. So let's identify first the classification of diseases according to etiologic factors. So we have hereditary diseases due to defect in the genes or one of other parent which is transmitted into the offspring. It can be congenital defects or congenital diseases due to defect in the development, hereditary factors, or prenatal infection. Another is we have metabolic diseases due to disturbances or abnormality in the intricate processes of metabolism. Another, we have deficiency diseases, results from inadequate intake or absorption of essential dietary factor. Next is we have traumatic diseases due to injuries or fractures. Next, we have allergic diseases due to abnormal response of the body to chemical or protein substances or to physical stimuli. Another, we have neoplastic diseases due to abnormal or uncontrolled growth of cells such as cancers. Next, we have idiopathic diseases. The causes is unknown. It's usually self-originated or of spontaneous origin. Next, we have degenerative diseases. This results degenerative changes or degeneration that occur in the tissue and organs. Or lastly, we have iatrogenic or results from the treatment of diseases. So that is the classification of diseases according to causes or etiologic factors. Now, another classification of disease is according to duration or onset. So we have acute or chronic. So acute illness usually has a short duration and is severe. Signs and symptoms appear abruptly, intense, and often subside after a relatively short period. While chronic illness usually happens longer than 6 months and can also affect functioning in any dimension. The client may fluctuate between maximal functioning and serious relapses and may be life-threatening. It is characterized by remission and exacerbation, which means remission is periods during which the disease is controlled and symptoms are not obvious, while exacerbation is the state where the disease becomes more active, given again at the future time with recurrence of pronounced symptoms. And lastly, according to duration, we have subacute. When we say subacute, symptoms are pronounced but more prolonged than the acute disease. But it is not longer than chronic illness. Okay, so these are the classification of disease according to duration. Again, we have acute, chronic, or subacute. Now, diseases may also be described as first, organic. When we say organic disease, this may result from changes in the normal structures, from recognizable anatomic changes in organ or tissue of the body. It may be another classification is functional disease. No anatomical changes are observed to account from symptoms present but may result from abnormal response to stimuli. Another is we have occupational disease. This results from factors associated within the occupation engaged in by the patient. Another, it can be a venereal disease, usually acquired through sexual relation. Another, we have familial disease. This occurs in several individuals of the same family. Another, we have, it can be a epidemic if it attacks a large number of individuals in the community at the same time, such as your SARS or your COVID-19. COVID-19 was identified as pandemic. So it started as epidemic until they become a pandemic, in which pandemic is extremely widespread, involving the entire country or world or globe. Now we have here endemic, presents more or less continuously or recurs in a community. Example, malaria, dengue, goiter. Okay. Next, we have pandemic. Again, it is an epidemic which is extremely widespread, involving an entire country or a globe. And then we have also sporadic disease, which is a disease in which occasionally cases occur, such as dengue, leptospirosis. We have schistosomiasis, trichomoniasis. So these are just example of your sporadic diseases. So now let's talk about the Level and Clark's 3 levels of prevention. So how can we prevent diseases? Now, you have to learn this one because you will help the patient identify these levels in order to prevent diseases. So, Level and Clark describes 3 levels of disease preventions. Namely, we have first the primary prevention. Primary prevention aims to prevent the disease before it occurs. This involves seeks to prevent a disease or condition at the pre-pathologic state or to stop something from ever happening. So this includes your health promotion or specific protection. So health promotion such as through health education, marriage counseling, genetic screening, and good standard of nutrition. For your specific protection, this may include use of specific immunization, attention to personal hygiene, protection against occupational hazards, protection from accidents, or protections from carcinogens. So that's all. That is for the primary prevention. Another is the second level is your secondary prevention, also known as your health maintenance. This focuses on early detection and prompt treatment. So this seeks to identify specific illnesses or condition at an early stage with prompt intervention or to prevent or limit disability, to prevent catastrophic effects that could occur if proper attention and treatment are not provided. Now, we have here the two concepts belong here is your early diagnosis and prompt treatment and disability limitation. So early diagnosis involves case finding measures, individual and mass screening survey, prevent spread of communicable disease, and prevent complication and sequelae, shorten period of disability. As for disability limitations, adequate treatment to arrest disease process and prevent further complication and sequelae, and provision of facility to delimit disability and prevent death. Example, detecting hypertension early during routine health checkup so that the patient can prevent complications such as stroke. And now what will happen if the patient will have stroke? They will have either mild paralysis or full body paralysis. So in order to prevent that kind of complications, early detection is important, which is the secondary level of prevention. Now, the tertiary level of prevention occurs after the disease has been developed. So, occurs after a disease or disability has occurred and the recovery phase has begun. The intent is to halt or to stop the disease or injury process and assist the person in obtaining an optimal health status. So this is to establish a high-level wellness or to maximize the use of remaining capacity. So this focused on rehabilitation and preventing further complications. Examples, We have work therapy on hospital or use of shelter colony, or physical therapy for stroke patients, rehabilitation programs for smokers or drug addicts, or long-term disease management. So in summary, health and illness are dynamic and factorial processes involved or influenced by biological, psychological, social, and environmental factors. Your role is not only as the future nurse, your role is not only to treat disease but also to promote wellness, prevent illness, and support patients throughout the healing process. Understanding these concepts will help you provide holistic and patient centered care. So that's all for this video. Thank you for watching and wassalam.